Um, there's a decision to be made when it comes to abortion pills and medications. Now this one judge is determined to make medical abortions more painful than what it is for women. Now, now the abortion pill decision proves yet again, many times over, that there's nothing pro-life about Republicans as the Republicans try to claim they are. Republicans are not. They're not pro-life. They are pro-birth. And after the woman gives birth, Republicans are like, "Fuck you, you're on your own," and then you got to take care of the kid. They don't get. All they care about is getting the kid born, and then they can give two shits after the kid's born about what happens to it afterwards. Now, the most crucial thing to understand in the aftermath of Friday's decision to rescind the FDA approved approval of mifepristone by the Donald Trump appointed judge Matthew Kacsmaryk is this: it's not a ban on medication abortion in the U.S. In the U.S., pill-induced abortions will still be available, even if this decision is allowed to still stand. They will continue to be safe, but aborting a pregnancy without mifepristone will just be a more miserable experience than it was before. The far-right district court judge ignored all law and science to impose his anti-choice ideology on the healthcare access of millions of Americans. Now, there has been talks about switching over to I'm not sure if I'm saying this right, misoprostol only regimens. This is what Dr. Kristen Brandy, who's an OBGYN, and she serves as the head chairperson of Physicians for Reproductive Health, had told Salon. The World Health Organization has long approved misoprostol only abortions. Now, right now, the standard practice is for a patient to take mifepristone, which causes the pregnancy to stop developing, followed by the misoprostol, which expels it. Now, however, misoprostol only abortions are incredibly safe and effective, Dr. Brandy would continue to say. Just not our first choice. That's because misoprostol only abortions have more side effects. She explained that it causes people to feel crampy and uncomfortable, but it can also cause people to throw up and have fevers, and it's also more likely to result in an incomplete abortion, requiring a patient to return for more follow-up care. Now, in other words, Kacsmaryk's decision, which the Justice Department asked the Federal Appeals Court to block on Monday, serves no other purpose but to punish patients who seek abortion by making the process more miserable than it needs to be for them. That's just it. It doesn't make abortion illegal. It doesn't make patients less likely to seek an abortion. It doesn't reduce the need for abortion. But it certainly doesn't make abortion any safer. And this is only about the sadistic desire of Republicans to inflict unnecessary pain on abortion patients. It's pure misogyny, done only because Republicans haven't figured out a legal way to flog women in public for having sex. Extreme bad faith has always been the dominant feature of the anti-choice movement. Its leaders love to claim opposition to abortion is about life, a facile claim that's easily disproved by the right's opposition to any other policies, from universal health care to an expanded social safety net to free contraception. And it would reduce the need for abortion. But even by the basement-level standards of the religious right, Kacsmaryk's 67-page decision is a whirlwind of dishonesty. He falsely claims that his decision to block the use of mifepristone is justified and necessary to protect the public's health. He grouses that the side effects include cramping and bleeding. But as Dr. Brandy had explained to Salon, mifepristone reduces the amount of cramping and bleeding patients experience, and the drug exists as to make abortion safer, quicker, and less painful. And Kacsmaryk pretends that he wants women to avoid cramping and bleeding, but by imposing this rule, he has only ensured that women will endure more cramping and bleeding. And for women who abort, and make no mistake, women will continue to get abortions whether Kacsmaryk likes it or not. The process will suck even more. And for women who continue pregnancies and giving birth is not the choice for those who would like to avoid cramping and bleeding. The main impact of this abortion pill decision will be to increase the amount of unnecessary suffering that women endure. Despite that obvious and easily verifiable fact, the New York Times is still carrying water for the religious right, publishing a puff piece about Kacsmaryk on Friday that downplays the malice underpinning his decision it falsely implies that he means well by women, which he does not. The article heavily quotes Sherry Statler, who receives donations from Kacsmaryk for her anti-abortion center. I just know that he has a real tender spot for caring for women, which he does not. Now, this, of course, is the opposite of the truth. The New York Times writer, Addie Van Sickle, leads it. but there's a substantial public record indicating that Kaczmarek is motivated mainly by a far-right belief that non-procreative sex is sinful, and that the government should punish people for having it. As the Texas Tribune reports, before he was a judge, Kaczmarek was a lawyer for the First Liberty Institute and was heavily involved in filing lawsuits to prevent women from using health insurance to pay for contraception. He's also against LGBTQ rights and has argued that healthcare workers should be able to deny people deny people care simply because they're gay, which you cannot deny somebody health care because they're gay. Kaczmarek has a favorite term to smear anyone who believes women and LGBTQ people have a right to sexual anatomy. Sexual revolutionaries is what he calls them. In 2015, he condemned the sexual revolutionaries who he believes that it's okay to have sex without procreation. In the same piece, he denounced 1965 Supreme Court decision that legalized contraception. And he goes way back to the phrase again and again when condemning legal abortion, same-sex marriage, and accepting trans people. Anything that's not procreation-oriented sex inside a marriage is, in Kaczmarek's long-writing career, a sexual revolutionary. Now, Kaczmarek's definition of sexual revolutionary is so expansive, in fact, that it captures nearly every adult American. In 2006, statistics showed that 95% of Americans have sex outside of marriage by the age of 44, a number that has likely only risen since then. Over 99% of sexually active women have used contraception, and to be a non-revolutionary in Kaczmarek's topsy-turvy worldview, you'd have to be a part of a minority so tiny as to be statistically insignificant. Now, these statistics matter because it really underscores how, despite all the successful spin Republicans put on the anti-choice movement in the press, it's actually a small minority of radical fundamentalists. It helps illustrate how much this movement is not about life and certainly not about helping it, but it's a movement rooted in the deeply sadistic urge to inflict pain on other people for having very normal, natural, and universal desires. Now people have the desire to have sex without making babies, but Kaczmarek can't turn women into what he wants them to be, which is desire-free dolls who only tolerate sex in order to procreate. But he can make them needlessly suffer for the sin of being human. Sadism and misogyny are what fuel the anti-choice movement, and this abortion pill decision is crystal clear proof of that. So if you like the video, you can give the video a like and subscribe to my channel, RBW King. You can also hit the notification bell so that you'll be notified when a new video comes out. Also hit the like button. And also you can leave a comment, let me know what you think. And if you want to support my work even further, you can donate to my Patreon link, which you can find in the About section of YouTube. And for just a little as $3 a video or a month, your donation can help go a long way. And thanks for listening.